It's summertime, 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 summertime.
Well, shut them books and throw away. Say goodbye to dull school days. Look alive and change your ways. It's summertime. Well, no more studying history and no more reading geography and no more geometry because it's summertime. It's time to head straight for the mills. It's time to live and have some thrills. Come along and have a ball, a regular, all free for all. Well, are you coming or are you late? Your slow thoughts are one complaint. Hurry up before I'm late. It's summertime. Well,
Hello everyone. Welcome to the Skilled Wound Care Update for the week of April 23rd, 2012. I am Dr. Bardia Anvar, and we're here with the Skilled Wound Care program to update you on one of the great summertime rashes which cause a lot of problems for infants, adults, and elderly patients in skilled nursing facilities, heat rash or sweat rash. In the medical terminology, we refer to heat rash or sweat rash as miliaria. And miliaria occurs in all these patients like I described. And in order to understand this disease, I'm first going to go over the skin pathology or skin biology of the disease. As we have mentioned before, the skin is made up of two major layers and then multiple minor layers, but I'll stick to the major ones, the epidermis and the dermis. In addition, we have sweat glands in the skin which help our skin regulate temperature. These sweat glands can be seen at the reticular dermis level. What happens when our patients begin to overheat and the skin begins to get hot is that we begin to sweat. And these sweat glands produce sweat that comes out of the sweat gland onto the skin. In this disease, sweat rash or heat rash, the skin actually gets blocked and the sweat cannot escape from the skin, resulting in increasing the temperature within both the epidermis and the dermis. From that, we begin to see the skin to develop a rash called the heat rash, and the rash begins as small, tiny bumps in the skin, and that is called miliaria crystalline. The bumps may get bigger and erythematous, and then we begin to call that miliaria rubra. And then the bumps may get infected with bacteria, and then we call that miliaria pustulosa. In the nursing facility, patients have difficulty turning, and also they may be under blankets or sheets and may be wearing tight-fitting clothing. These patients lie on their backs with the difficulty of turning and they begin to heat. And this heat causes them to sweat. However, the sweat cannot escape because of either the sheets that are found over the patient or the actual clothing. So the best way to prevent this rash from occurring in the nursing facility is by turning the patient and letting the back air out. In addition, this rash may become very itchy for the patient. So we recommend steroid creams when we see the patient, or in some cases even drying agents to slow down the sweating. However, it's very important in nursing facilities in the summertime when humidity increases and temperatures increase that we start to make sure that the temperature in the facility is in a moderate or a cool zone, and also that the patients are being turned and fanned on the back, and the back is actually exposed, because the majority of this disease is seen in patients' backs, sometimes within the skin folds. The other population which this disease affects is obviously infants, like I spoke about earlier, and that is because their sweat glands are not well developed, and underdeveloped sweat glands, obviously, they cannot release the sweat from the skin, and they also develop a rash. Same thing with infants. This is occurring because they're in temperatures of high heat or high humidity. So on your next family vacation to Hawaii or wherever it is you go and you want to take a nice tan, or you go out sunning with a baby or the whole family, you want to keep this in mind. For adults, also sitting out in the sun, in a hot sun, on a hot sunny day, your body is going to sweat a lot. And that sweat needs to be released. If the sweat is not being released in a timely fashion, the same rash will develop. First thing you want to do, get out of the sun, stop sunbathing, take a nice cold shower, put some hydrocortisone over-the-counter creams on, and try to control yourself from itching, because itching can actually inflame and prolong the response of this disease. In the elderly population in the skilled nursing facility, the other thing we worry about is misconfusion and thinking this is a communicable disease that is being transmitted from one patient in one room to another patient in another room, and then we confuse it for diseases such as scabies, bed bugs, or bites, that there is some kind of infestation with a facility. However, we will see a lot of patients in the facility with this type of rash, and that's only because probably the temperature in the whole facility is high, as well as the humidity. So we want to be very careful to control temperatures in the facility. So if you start seeing rashes in the summertime starting in the facility or on hot days, think of this disease and take a look at it, and take a look at our different literature that we have on how to specifically identify this disease. Once again, I'm Dr. Bardia Anvar with the Skilled Wound Care Program. We also have a nice text that we've written for our wound, skin, and ostomy certification course, and we will be notifying you of when the next opportunity is to come and learn in that course, which is majority of what I've been teaching in these videos will be gone over in depth, and you will be tested on it. And I'm Dr. Anvar, and I will see you on the field. Thank you.